Today, I want to talk to you about hysterectomy. By definition, it's when a woman has her uterus removed. It can be done with or without removing the ovaries. We usually take the fallopian tubes, regardless of whether the ovaries are taken or not. And that's because a lot of ovarian cancers are found to actually come from the fallopian tube. So back to hysterectomy. There are several different ways to remove the uterus. The easiest to recover from is by operating all through the vagina. It's called a vaginal hysterectomy. The other easy way to have one done, if there is such a thing, is by having it done laparoscopically, or better yet, robotically. And that is a technique where small incisions are made in the abdomen, the tools are outside of the abdomen, and it's detached, if you will, by using the tools that are going into the abdomen, and then usually withdrawn through the vagina, and that incision in the vagina is sewn up. Robotically means that the instruments are in the abdomen, but they're also attached to a machine which is operated by the doctor, who sits at a console beside the machine. And it's a better technique because the surgeon can see with two eyeballs, which means they're seeing it in 3 dimensions. And the instruments are different than laparoscopic instruments. They actually reticulate. It's like using your own hand and wrist. And you can look under things. It's a better technique. Yes, the equipment's expensive. It costs more to do it that way, but it's a lot safer. So there are definite advantages, but perhaps I should back up and we should talk about why someone might need a hysterectomy and how we work that up. Sometimes the bleeding that I talk about in a different segment, the heavy irregular bleeding, even with progesterone, doesn't get better. It's not controlled by that. So women sometimes have to have a hysterectomy because they have uncontrolled bleeding. Before the hysterectomy is done, there are a number of steps that need to be taken to evaluate them to make sure there's no uterine cancer in there and no masses or ovarian cancers or masses. And so it involves doing an ultrasound, which will rule out most of that stuff, and usually will ensure that the lining of the uterus is so thin there can't be cancer in it. But any one of the techniques could be used depending on that woman's history of childbirth, whether she's had vaginal deliveries or C-sections, and other risk factors. All of that's taken into consideration when determining how the hysterectomy is performed. So one reason is uncontrolled vaginal bleeding. Another is chronic pelvic pain. Chronic pelvic pain is pelvic pain that has been there for, pick a number, 6 months, a year, that has no definable cause or is specifically caused by endometriosis. So when you first come in and you see us and you have pain in your pelvis, pain with intercourse, one of the first things we'll want to do is make sure it's not an infection. Well, once that is ruled out and taken care of, a woman that still has pain, it may be related to her menstrual cycle. That helps us figure out what might be causing it. So before you go in to see the doctor, try to pay attention to when your pain occurs in relation to your menstrual cycle, and that will help. You may need to have surgery done just to look inside and see if there's certain conditions. And I am going to explain to you what endometriosis is. But surgery that's done before a hysterectomy would be a laparoscopy. The belly button surgery, the same type of surgery done to take your gallbladder out. And we're looking in the other direction down into your pelvis to see if there might be endometriosis. Usually that's the reason for the laparoscopy. Well, what is endometriosis? Well, back to the endometrium, that's our word for the lining of the uterus. That's what's supposed to grow and shed every month when you have a menstrual period. But sometimes microscopic islands of cells float out through the fallopian tube and end up on the tissue that lines the pelvis. That's a fertile environment. It lands there and it starts growing. It sets up housekeeping and forms little pockets of, or blebs. They're usually pretty small, but can cause a lot of pain. It sets up housekeeping, starts to grow, and interestingly enough, because it's endometrial tissue, it responds to the ovarian hormones in the same way that the lining of the uterus does. In other words, it grows from estrogen, it matures from progesterone, and then when the progesterone stops, it tries to shed like the lining of the uterus, but it doesn't really have anywhere to go. One other thing that happens when the lining of the uterus is shed, as in a menstrual period, is other hormones and chemical hormones are released from the endometrium, such as prostaglandins. And those cause symptoms: pain, diarrhea, nausea and vomiting sometimes, and menstrual cramps. Well, picture those same chemical hormones being released in the tissues surrounding these tiny implants of endometriosis. Well, they're very painful. And so if it helps to know whether or not there's a pattern, a cyclic pattern to the pain, and endometriosis tends to be more painful before the menstrual period starts. In other words, in that last week or two before you actually bleed. But it also didn't read the books, and it can happen any time of the month. Some women have more pain during their cycle. So it's hard to diagnose unless we get in there with the laparoscope and look and biopsy. That's how you tell if someone has endometriosis. So if you've been to the doctor for pain and they do an ultrasound and say, I think you've got endometriosis, don't hear that as them saying you have endometriosis, because the only way they can know for sure is to look inside. It can run in families. It can be in very young women. Sometimes it's very mild and doesn't need to be treated, but sometimes in some women it's so severe that they've been treated in multiple ways through the course of their years, if you will, and they just reach a point where nothing has worked and they've had this pain for so long, they're ready to be done with it, and they ask you to do a hysterectomy. Well, in that case, if we know for sure the pain is from endometriosis, they may not get better unless their ovaries are removed, because remember, it's the ovaries and the hormones they put out that cause the endometriosis to grow. So think about it. There's no way to remove all the endometriosis. That's just not possible, because it hides in places where you can't really see it, like under the surface of that tissue, and it grows deep. And some of those implants are in places where you can't burn or cut, like on the bowel or on the ureter. So the only way to really fix it is to take the ovaries out as well. And I've seen women in their 20s beg to have that done because they've suffered so much for so long. Fortunately, it doesn't happen to everybody that has endometriosis. Some people respond to hormonal therapy. If you're wondering if that might be you, ask your mother or sisters or aunts if they know of anyone in the family who had endometriosis, because it can run in families. I know I started talking about hysterectomy, but I sort of got sidetracked on endometriosis because it's an important reason for taking ovaries out. And the workup is similar: ultrasound. If nothing is seen and it's chronic pain and it may or may not follow the menstrual cycle, sometimes you just need to have a laparoscopy done to see what's causing it, then have a treatment plan prescribed. If you end up with a hysterectomy, how long does it take you to recover? Well, I try to make sure people understand that it's major surgery and your body has to have time to heal. And in the process of healing, you're going to be tired. So you'll have fatigue, and it may take you up to 6 weeks to get over that. The pain doesn't seem to be the biggest issue, especially with a vaginal hysterectomy or a robotic hysterectomy. And the surgeons in my practice, Dr. Ashcraft and Dr. Knockout, pretty much do those two types of hysterectomies, either robotic or, when appropriate, vaginal, and they're very good. So those surgeries, the pain isn't going to be a huge factor unless you just go nuts and overdo it. Give yourself a couple of weeks of downtime. Take care of yourself, eat right, drink enough water, walk out in the sunshine hopefully, or get some fresh air, and then gradually increase your activity level. But you shouldn't have a whole lot of pain. And most people don't even require narcotics after a hysterectomy in this day and age. Back to endometriosis for a minute. If you had that and you had your ovaries out, I would keep you off estrogen for at least 6 months, but put you on progesterone. It's a female hormone. We know that taking it will suppress growth of the lining of the uterus, and it may help some of your menopause symptoms. And after 6 months, stay on the progesterone and add a little bit of estrogen to help preserve all of your other organs. Or come see us. Thank you.